And I think some people ask me what is Dr. PH, that is Doctor in Public Health.
Yes.
Okay, thanks.
Good afternoon, everyone. I think that this thing is as big as me, so I'll just stand on this side. Can everyone hear me okay? Yes. Okay, perfect. Good afternoon, Provost, distinguished faculty, students, visitors, and my mother, who actually came along with me today. I know that this is a very intense time with school about to end, and so I appreciate you all coming to this lecture, and I appreciate the invitation by the dean. I decided to come here as a private citizen so I can talk more about my personal experiences growing up in this neighborhood and not even thinking that I would end up working in DC. My thought from my guidance counselor was, well, after Hillcrest, you can go to ITT Tech and maybe make handbags. And so, you know, my thought wasn't where I ended up. And so I just want to talk about my journey. But more importantly, I know that this is the arts and sciences, and we probably have students from other disciplines. Wanted to talk a little bit about this thing called public health and exactly what it is and the avenues that you can go to in public health. And even outside of public health, how we all kind of fit into this whole public health atmosphere. So I will be very brief so that you can get to the most important part, which is food and the rest of your life as well. Okay. So in terms of what is public health, I think the important thing to define is actually what is health. And you know, there's so many different definitions for health, but in essence, health is the absence of disease and disability, and definitions have been expanded to include social, spiritual, and mental health. But the objective of public health is really to improve the health of individuals and society. And so really public health is really a comprehensive approach to promoting health of individuals, and it's based on balancing sanitary, environmental health, and health promotion. And where I fit into this is growing up here in Jamaica, Queens, I didn't even know that York College had all of this. I was just 4 van, 44, I think that's the bus, 25, 34, walk to Hillside, you know, and that was kind of my circumference. But one of the things I learned as I've advanced in my career is I've seen a lot of things around my environments, but I didn't quite know what the word was for it. And so that's what I want to kind of highlight today in terms of some of the public health words that kind of shape how we think about minority health and health disparities. And so the difference that I like to talk about in terms of public health and medicine, and if there's any physicians in the room, I hope you don't hate me about this, but medicine, you come and you see the doctor, they see the family, whereas in public health, it's a real population approach. And I know that this university was really instrumental during Sandy, and of course that's a great demonstration of assisting during a public health crisis. And in terms of who the experts are in public health, the experts in medicine are physicians, but in public health it's researchers, it's chemists, it's the sanitation workers, it's actually the dance teachers, so it's everyone collectively that's really enhancing the health of the community. But did I know I wanted to go into public health when I was at Hillcrest? No. I think I tried to get into the nursing program, but then I think I went to Margaret T's nursing home, which is, I think, not too far from here, and the lady started bleeding, and I said, oh, I can't do this. I don't think that this is for me. So I didn't know public health was going to be my career, but I knew I wanted to do something in the health field, and the only thing that I was exposed to was nurse, doctor, radiologist. And so who knew that there was a whole nother world called public health that kind of encompasses so many things. And in terms of how you make assessments in public health, because one of the things that I've learned being in DC is it's great to have these great ideas, but I think as a Food and Drug Administration personnel, all we do is assess. And so being able to kind of report what you're doing. So in medicine, you're assessing by people's medical history, lab tests, et cetera, whereas in public health is really diagnosing the community, making interventions, and actually following up and tracking them. And just to talk more about disparities, because that has actually been the backbone of my career. And when people say disparities, a lot of people have a lot of different definitions. There are disparities in education, there's disparities in the criminal justice system, but in public health, we're really talking about an inequality of a health status, something that's unfair and unjust. And so kind of how does this all add up in terms of what exactly is public health? So we're talking about the differences between two or more populations and groups by disease, by injury, by death. Whereas when you're talking about disparities in healthcare, you're talking about access to care. And they can be insurance coverage, education, occupation, all these different things. This is one of my favorite models, just in terms of understanding the whole area of public health and how it intersects with everything. I think it was last weekend, I drove along, I got lost, and I was next to the Coliseum. and I don't know which street that is, but as I was looking at the Coliseum, I said, wow, this looks different from when I used to grow up here. Because as I looked at the Coliseum and I was looking at the areas, I said, well, where do people who live in this area go for fresh food and fruits? Anyone know? So if you wanted to go to a grocery store and get some fresh fruits and something that's really great and wholesome with the, grocery store where the water comes down, kind of like a fairway, where would you go? What's the closest grocery store here? Nobody eats here? Closest grocery store. Farmer's market? Okay. What else?
The food court.
Food court. Okay. Here on campus.
No, right by the farmer's market.
Okay. So what does the food court look like?
A large space with a bunch of kiosks.
Okay. Does water come down, and is it like a very pleasant environment when you walk inside? I haven't been to it.
It is pleasant. There's no water, but there's a lot of sun.
Okay, very good. So when you're talking about public health, it's also talking about the area around you and looking at various neighborhoods. One of the things I noticed as I was driving around the Coliseum is I said, well, if I wanted to get a quick something to eat, where would I go? And so thinking about different communities and built environments, that's also all public health. And really looking at how all of these intersect together to cause disparities is a major focus in public health as well. Looking at risk factors such as diet and weight, it's not an accident that if you're depressed and everything around you is maybe a liquor store, you might drink. It's a given. It's not an accident if Whole Foods is right next to you and you actually have a pretty decent salary that you might shop there. Or if that's not close to you and it's the bodega, and even though it's $5 for a piece of bread, I need the bread right away, and that's the closest thing to me. That's also public health in the sense that you have what they call the food deserts, or environments where there isn't that much of a concentration of fresh food. One of the paramount studies in 2002, and looking at disparities, and I'm saying paramount being, a lot of people like to talk about this Institute of Medicine study that looked at disparities across various races, of course, various economic statuses. But one of the things I like to tell people during my talks is, disparities or inequalities in health is not a new phenomenon. You can go to Miss Reed around the corner and she can talk about disparities, but you all are here at an academic university putting real terms to what you see. And so even in terms of health disparities, public health, and all that I'm speaking about, community members know about this already. They've lived it. They already know about it. W.E. Du Bois, in his book in the 1900s, in the Philadelphia Negro, he talked about inequalities in public health. He talked about health disparities, but it wasn't termed health disparities. One of the major findings of the study is that there are many sources that contribute to disparities in health, and there's no real singular solution. Just a quick example, this is a little bit old data, but when you break it down even more, just looking at the disparities in diabetes, and this is a very basic level, but one of the things that I try to do in my office, but also as a researcher as well, is even in terms of these racial and ethnic categories, when you break down American Indians, Alaska Natives, Asians, and Pacific Islanders, there's so many groups within that group that gets lumped together. So oftentimes in public health, you can't really see what the true cause of you can't really see the true prevalence of a disease or a particular ailment. So what are the causes of disparities? I'm talking about these fancy words that a lot of people like to use, and one of the fancy words now is social determinants. And social determinants is, in essence, the things around you that impact your health. We talked about the farmer's market, the Whole Foods. What's your usual commute for people to come to campus? How long is your commute? 10 minutes, 15 minutes?
An hour and a half.
Hour and a half. Is that 2 trains?
1 train.
Okay, 1 train, 1 bus. Anyone a little longer? Okay, so when you're talking about health, you're also talking about what they call social determinants, all the things in your environment that might take a long time to get to something. If it takes you 2.5 hours or an hour and a half to go to the doctor, are you going to really feel like going? So it's really looking at these environmental structures and how they impact people's decision. The other thing is there's something called social cohesion, how neighborhoods come together. And I always say if I actually wanted to go back to school, which I don't want to, even though I look like I'm 12, I would probably become like a regional planner. I didn't realize that there's so much to health in terms of what your area looks like. And so when you have parks, when you have restaurants like Fridays and different things like this, they actually bring neighborhoods together. But certain neighborhoods, you don't really have cohesive opportunities places for your kids to play, places for you to kind of come together with your friends and family. That brings cohesion. Because one of the things they find about disparities or social determinants is that it can be decreased if you have more cohesion in communities. Access to care. You know, if you live an hour and a half away, you might not feel like going to the doctor. And of course, healthcare in general. And this whole thing about disparities that I'm talking about has a lot of different components. And I think one of the things I want to leave you today is that it's not just one source in terms of the disparities that we see. But there are a lot of biological components, from HIV to cancer and increasing incidence in all this. And it's also exacerbated by environmental occurrences such as what just happened with Sandy. Poor housing, poor access, and we talked about, you know, a bodega may be closer to you than Whole Foods, and also crime. And there's also social components as well, such as absolute income, educational attainment, etc. I was thinking about when I just paid off my student loans. You can clap. Okay, thank you. Just paid off my student loans. So it's been about 15, 16, 17 years, but thinking about your absolute income, the income you're actually going to take home and how that's actually going to impact your family has a huge thing to do with health. And when you're looking at different race and ethnicities, you know, it's very different. I don't know if anyone here was left a large estate, but I wasn't. No offense, Mom. It would have been nice, but I wasn't. But those type of things change the trajectory of your life. So when you're looking at public health, it's definitely not just an absolute, this is why a person is unhealthy, but there's a lot of different things. Even in terms of educational attainment, I know when I was graduating from Hillcrest, my thought was, I had a similar commute to yourself. I think it took me about 2 hours. So I took the 4, and then I took the van sometimes, and then if I felt lazy, I took the 25, 34 up the hill so I didn't have to go to Hillcrest. But when I thought about college, I thought, I don't want to do that. Can't I be in an environment where I roll out of bed and get there in 10 minutes, you know? And so thinking about how to make your life easier and kind of educational attainment and how you get there is a challenge oftentimes when you're in an urban environment. You see people doing things, but exactly how to get there is not quite relevant to you. The other part is when you're talking about culture and ethnicity, if you come from a household where everyone has gone to college, you kind of know what to do. But if your parents are new to the country and you're asking them about ACTs, SATs, they're like, I just want you to do well. I can't really give you any direction. And so also finding your way. So all of this kind of impacts how a community ultimately functions. And I talked about social cohesion and how things come together. One of the best experiences that I had was being on the track team at Hillcrest High School, and that actually ended up getting me a scholarship to Morgan, but I gave it back. That's why I still have student loans. It was a little too intense. They thought we were going to the Olympics, and I was just trying to get through school. But I realized that cohesive environments, such as the exhibit that you're having here, being a part of civic organizations, being a part of whatever's going on in campus, being a part of your community, that actually impacts your health. That brings you together. I know that there's probably nightmare situations with group projects. I'm sure no one had such an experience, but you know, learning how to work with your neighbors, that's huge when you're talking about health. So all this kind of meshed together in political systems, the economy, and medical understanding. One of the great things about my role as the acting director of the Office of Minority Health is right when the legislation was passed, I was able to kind of see how policy is made. So people talk about policy, but really looking at how stakeholders and communities kind of drive a particular initiative and how it becomes law. That was a great experience. And I think one of the things that I neglected to speak about, which will be the second part of my talk, is the issue of trust. And so when you're talking about social determinants, when you're talking about public health or health disparities, trust is a huge component. And oftentimes, if you don't have trust, you don't have any good care. I'm not sure if anyone here ever experienced going someplace and someone kind of clutching their bag, or they're not sure if they want to let you in. I'm sure that's never happened to anyone here. But when you have experiences that you feel injustice occurring, it makes you not want to kind of go back and perpetuate or go back and solicit that type of thing. So when you're talking about healthcare, trust is a huge component as well. And I also like to use the word trustworthiness. You know, it was mentioned that I did my postdoc at Hopkins. One of the interesting things about Hopkins is they get lots of money. I know they recently just got a $600 million grant to kind of reinvest in the community. And I was at a board review, and actually this was just 2 days ago, where I was sitting before a committee and we were reviewing who's going to get this $7 million. And I was thinking, wow, I'm just a little girl from Jamaica, Queens, and I'm deciding on who's going to get $7 million? That's a huge responsibility, but I think having grown up in this environment and thinking about real life people, and if the money is eventually going to get into the community, that was huge. But more importantly, thinking about trustworthiness. If you are a large academic institution or a small academic institution, how much are you reaching out to your community? That's why I'm really impressed of your college and how they've really, from what I've seen, reached out to high schoolers, reached out to other colleges and other universities, and that's a huge component in terms of being trustworthy or worthy of someone's trust. And lower trust leads to wariness of encounters, increased weight, negative events. I know that finals are coming up, and so lots of people are stressed from the professor side and the student side. But when you get stressed, that increases your likelihood to get other diseases and other ailments. So there's a huge correlation between stress, body weight, and some of these other things that we've talked about. And I think the other important part when you're talking about trust and when you're talking about health disparities or the disparities of communities are that there's history. Everyone comes with a particular type of history, and unfortunate for my students who have to see some of these slides over and over again, my dissertation focused on historical abuses and how that impacts people's decision making. And so people are often taken aback. I can't believe you work for the government, but you studied so much about government abuses. That's a whole nother conversation, but one particular abuse, which when I was doing my research, and I hear this when you're talking about healthcare as well, was the research done by, he's called the father of gynecology, and his name is J. Marion Sims, and he actually has a statue at the University of South Carolina, but he became very famous because he created the vaginal speculum, and he did this, created this instrument by doing abuses on slave women. And so when you're talking about African Americans who have a long history of slavery in this country, but also of successes, and you're talking about, making sure that they become a part of healthcare, it's important to kind of validate people's past historical incidences. There's also been discussions and talks about major research in universities, and one of the things when I used to work at Hopkins, people would say, well, you don't want to go out probably after 12 midnight. And I said, oh, why? Because it's dangerous? No, that's when they start looking for bodies. And this is what older, maybe 60 or 70-year-old women would say to me. And I said, looking for bodies. And so there's a conversation among a lot of large academic areas where there's a concentration of underserved people where they know not to go out at a certain point because family members have said for generations, you don't want to, you don't want them to steal your body and kind of experiment on you. So trust is huge, and it also impacts kind of how people perceive themselves. And then you all might have heard this 100 times before, but unfortunate for you, I did my dissertation on it, so I had to throw it in when I was talking about this area of trust, is the U.S. Public Health Service Tuskegee Syphilis study, which went on from 1932 to 1972. And in essence, they called it the study to treat syphilis, but it was actually an observational study where they watched men and they wanted to see the progression of syphilis. And people often cite it as a reason why people don't want to participate in healthcare, but I don't think it's the only reason. And the men were in Macon County, Alabama, and they were told that they were receiving treatment. Now, the reason I bring this up is because everyone that's going to be graduating from this university, you're going to be seen as leaders. You're going to be seen as, people who understand what's going on in communities, but also you can translate that to whatever your discipline is going to be. So people are going to value what you say. One of the key components of the study is that they used a nurse who was from the community to kind of recruit the students. And so even in terms of my career, making sure that you're one who is not necessarily a ploy to attract people towards negative occurrences, but you're really making thought-provoking decisions depending on what you want how you want your career to go. One of the misnomers about the U.S. Public Health Service Tuskegee Syphilis study, and I like to say that instead of Tuskegee, which I shouldn't have written, is that it was funded by the United States Public Health Service. So it wasn't funded by Tuskegee University, but I think it's cast a very negative shadow on the university, which is actually unjust. And the men were not injected with syphilis, but one of the things I found is that when I did a lot of focus group tests, a lot of people from various races said, oh yes, I heard about that Tuskegee thing. They gave the men AIDS. No. They gave the men syphilis. No, they actually watched the progression of disease, but when you're talking about anecdotal stories or stories that perpetuate among families in terms of why you should do something, why you shouldn't do something, this is one of the most commonly cited studies that people often use. And they gave the men very painful spinal taps. And there was a, you know, it was a horrific study, and it ended in 1972. But in essence, one of the U.S. Public Health Service workers said, they simply don't like spinal punctures. He was talking about the men. Others claim that they robbed them of their procreative behaviors. And so with that study, there were actually real racist ideologies that went about in terms of the framework of that study. It ended in 1972, but in 1973, there was a $1.8 billion lawsuit. Unfortunately, the victims of the study only got $37,000, but they were very grateful. There's a great tape interview of the surviving men. And in 1997, President Clinton issued an apology for that. So I guess my point is, when you're thinking about health disparities, when you're thinking about the syphilis study that I mentioned, it's not just Tuskegee, but Tuskegee often becomes an example for people that reiterates experiences that they've had in their life. And it ultimately impacts the attitudes towards medicine and towards public health. Sorry. And it actually perpetuates people's contemporary experiences. So if you feel a lack of respect from the man who's taking your Metro card, a lack of respect from the banker, a lack of respect from maybe even your family, that exacerbates in terms of how you view healthcare. And that's kind of my research interest, or what drove me into public health, understanding how people get their thought processes. And that's what actually led me to California when I worked on a couple of television shows. And it was interesting because it was one of those pinch me moments. Here's a little girl from Jamaica, Queens, and I'm sitting talking about ER, and we're talking about HIV and how they can accurately portray HIV, and making sure that what messages they were putting out were sound. And this is where, again, your environment and growing up and making sure that things are accurate come into play. I keep talking about this IOM report, but it's kind of one of the monumental reports related to minority health and health disparities. But the IOM report also found that racial and ethnic minorities tend to receive a lower quality of health care than non-minorities, even when access-related factors such as patient insurance and status are controlled. So just kind of repeating what I've been saying. And just to fast forward, why urban health? This is an urban environment. Why are we talking about health disparities and all of these different things? Why is it important? Well, it's important because ultimately everyone is trying to have a thriving society. But if that's not happening for the collective body of people, then these disparities are going to perpetuate. And so solutions to this, and the public health solution to this, is really looking at things from a historical standpoint, looking to see what people's ideologies are, and then working politically, and then ultimately getting it down at the community level. Yes?
I'm sorry, but I wanted to copy the list. Can we just go back 1 minute?
Sure. Actually, I could send you the slides, so I will give you my email address at the end.
Okay.
All right. One of the things that I think is monumental, and it was mentioned in my introduction, is a part of the Affordable Care Act. Of course, it's going to have a lot of money in terms of health insurance, but there's a whole nother part of it, even in terms of institutions such as yourselves that have a very multiracial population. And the aim of a portion of the Affordable Care Act is to really end health disparities. And the thought was, we have all these federal agencies. Shouldn't we have agencies kind of focus and hone in on how to solve this problem that's been around for years? And so this is actually a report that's online, it's free, and it shows a whole plan. And our office is mentioning it as well. So I talked about all these negatives, but this is kind of one small solution to the problem. But attached to all these solutions are federal dollars. So that's just a FYI for any professors looking for R01s. So why should we be concerned with urban or population health? The American College of Physicians said the fate of the inner cities is inseparable from the life of the nation. The current medical model is inadequate in the urban environment. Multifaceted approaches are needed. The medical model alone is woefully inadequate in the inner city. So depending on what your discipline is, I think it's a collective issue in terms of health disparities and the injustice that's going on in health right now. But it's not just a federal issue, but it's also academic. It's also a community issue. And there's also lots of different components, as we mentioned before. But also, there's also poor research methods, and that's why we need the scientists, we need the bench scientists. There's a poor understanding of population and social level determinants, and there's ultimately a spillover effect. And so what happens in the urban environments will eventually happen in the suburban environment. So it's all of our problems. Lastly, Martin Luther King said, why should we be concerned with urban health or population health? Of all the forms of inequality, injustice in health is the most shocking and the most inhumane. And that's one of the quotes that's actually citing in the Affordable Care Act in terms of leveling the playing field and making sure that these disparities don't persist. And that is it. And here's my contact information. I could send you my slides. Thank you.
Okay, let us start. Thank you very much,
Sure.
Michelle. Let us start with questions. First from the students. Okay. I know there are a couple of you who are here interested in talking to them. Ask questions, feel free.
No worries. I won't be offended. It happens in my class all the time. I was that boring, wasn't I?
She didn't get much sleep last night because she had to finish her grading. It had to be in, the grades had to be in right 7,
Yes.
like 4 o'clock in the morning.
Yes.
We had
Sure.
5 p.m.
Sure.
Yeah, so go
Quick.
ahead.
I can see you. I see you. Yes.
So one of the problems that I commute a bigger train, and I see a lot of homeless people with a very life.
Sure, and I think that's a great. He just asked about homelessness and kind of why don't people kind of do more to deal with homelessness, and something that you see on the train on a day-to-day basis. I think homelessness, just like minority health and health disparities, it's a multifaceted problem. And so, of course, I think you mentioned in terms of medication, there are definitely often mental health issues, but there's also, outside of socioeconomic issues, there's also job issues. There's also issues about insecurity, and so I think it's very complex. So oftentimes people will reach out, but in terms of them staying in a particular environment, oftentimes they have so many different problems that it's hard to kind of keep track of them. So one of the things that I know the federal government is doing, and they're asking various health departments to do, is looking at homelessness and even looking at healthcare from what they call a medical home model, meaning that you have actual caseworkers tracking all the different facets of a person's problem. So not just the physician, but the social worker, the mental health specialist, and really looking at it as a comprehensive approach. But I think the issue of homelessness, which I'm not an expert in, is it's just very multifaceted, and being able to kind of, after you've given someone the service, have them come back often doesn't happen.
So would you think it starts by the proper treatment?
And when we say treatment, though, does that mean treatment in terms of giving them a pill, treatment in terms of psychology, or?
Providing them with the services they need in terms of public
Right.
health.
Definitely, but that has to actually come from somewhere, and that's the challenge and the reason why we have the Affordable Care Act, or as some people like to say, Obamacare, making sure that we have some of these safety nets before people get to that level. None of us can imagine ourselves homeless, but I'm sure that there's probably someone here that's been homeless. So it's one of those things that is very multifaceted, but I think our public health system is broken. And I think after we acknowledge that and we figure out how to fix it, which I think the Affordable Care Act is not the only way to fix it, but it's actually bringing things together. It's great to have activities, but if there's no resources attached to it, how do you do it? And so I know we're talking about fiscal cliffs and all these different things that are going on, but I think the Affordable Care Act is going to be one vessel or vehicle that can kind of bring services a little bit more together to kind of do what you're saying in terms of really giving people the services and the things that they need, and it not being so desperate and just all over the place. Was there another question? Yeah.
Throughout your lecture, you mentioned being from Jamaica, Queens,
Mm-hmm.
within the context of having awesome responsibilities in your work. If you can discuss what were some of the challenges that you faced, if any, being from here through your journey through school, as well as the environment that you now found yourself in amongst people who are not from this area or not from the inner city?
Absolutely, and I believe in transparency and kind of telling probably more than I should about myself personally. I think my number one challenge, I love the New York public school system because it was free, But my number one challenge I had personally was I wanted to get into college. I thought I was a great student, but when I got my SAT scores, it didn't say I was a great student. So the grades were good, but at that time I think the level was, what, 1,600? I don't know what it is now. It was 1,600, and at that time I was a student athlete running around Hillcrest and running around this neighborhood and thinking, well, maybe I can get a track scholarship. I know I can't get an academic because my GPA is good, but my SATs don't correlate. And so my personal challenge was, how do I demonstrate that I have a 90 average, but my SAT score was 685, and you get 200 points for your name. So how do you make sense of that? How do you figure out what's going to be next? How do you even think about Capitol Hill when you don't even, you know you're going to graduate from high school, but how are you going to get to that higher institution? And one of the things, and that's why I talk about social cohesion or having environments, and that's why one of the things I like about the setting here at your college is, I think my mom and I were sitting right by the window. There's environments where there's just having a seat where people can kind of convene together is huge. And so one of the things I did in high school is was a part of all these different clubs. And I know one of my friends said, well, you know they have free prints and reviews if you're from like Jamaica, Queens, or some of these hood places. And I said, oh, because I didn't know I lived in the hood until people told me. But and we're afraid. I didn't realize that. It's interesting how your view changes. But I was able to take a 6-week prints and review class for free because I was an African-American woman living in the hood at Hillcrest High School. I took that 6-week test, and then I took the SAT, and I got 1,300. So was it me? How many other people probably had similar experiences like that where they're like, you know what, forget this, I'm not doing this, I can't do it. I'll go make pocketbooks like my guidance counselor said. So that was a personal challenge, but at the same time, had I not been a part of my high school kind of family and all the activities that they provided for me, that's why I always tell my students, it's great to be a student, but if you're not kind of engaged with your professors and understanding their journey and really being a part of your academic community, you've missed the boat. You know, it may take 2 hours to get to school, but stay an extra hour just to learn a little bit more about your professor's journey, just to be a part of that club that the people are kind of strange, but they might be able to help you in the long run. So that's just, one example of a personal journey. And it goes on, you know, financial and all that stuff. But at the end of that journey, one of the things I found is I'm doing okay right now. I paid off my student loan. I started at 6, whatever it was that I got in my SAT, but it was because I really had a collective people, not only where I go to for my spiritual enlightenment, but more importantly too, family, social support, and really being a part of whether it was my high school or my college or my graduate school's program. And so really partaking in the support that was given. Okay. Any other? Okay.
What are some opportunities for scientific researchers in the field to be directly involved with?
That's a great question. Can I just tell you that when I went to graduate school, and this is my personal experience, I didn't realize how much money the National Institutes of Health had for people who was interested in whether it's bench science, public health, nursing, various disciplines. And so particularly on the NIH's website, they have programs where you can get funding from high school level until post bachelorate. And I believe in specificity. When I made funding, the car that I'm currently driving, I bought it with my NIH funding. I don't know if I'm supposed to say that on camera. But in essence, I needed transportation. They understand about social determinants at the NIH. They're a research institution. They know what it takes for you to get your degree and what you have to have. They understood that a part of my dissertation and doing my research, I needed an LCD projector. So I got $2,000 for that. So going to the NIH's website and really looking, it's called, they have something called, and I'm not going to say that you're a minority. I don't know, you could not be, but there's something called an underrepresented minority supplement. And it goes from high school to post-baccalaureate if you're interested in the bench sciences, but also in the public health courses as well. And there's such programs for various disciplines, but that would be one thing. And what I often like to say to my students is, I didn't see you writing. Are you interested in what I just said? You gotta write it down. Okay. Sorry, that's my teacher hat. Okay. Any other questions? Okay. You know, that's a great question, and that's what led me to doing because I didn't know the answer to that question. I feel like I still don't. But one of the things I saw is that, you know, it's not a small thing to be a celebrity. Autism is not the #1 cause of death, but what's the #1 cause of death? Does anyone know? Heart disease. You know, you hear about it now and then, but it's really what I learned about the media and their role, from my vantage point, is their role is to perpetuate whatever celebrities are interested in. And so one of the things I learned about public health, which I think this goes for every discipline, it's almost like you have to find that spokesperson to kind of champion your mission. And they're out there. Because in essence, if I join a cause, that's going to be a little bit more of a tax write-off for me. So in terms of being more strategic about whatever it is you end up doing, I think the media plays a huge role. You can actually be running a community organization or running a group of people, and you don't have to be a press person to do a media advisory. And what a media advisory is, a short one-pager, hey, this is going on, and you kind of send it through the Associated Press. You have blogs, you have all kinds of things. And so I think one of the great things about social media is that we all become our own press people, but not everyone knows how to put that together. So one of the things I've seen is really having that champion, that respected person. You might not be able to get to Jay-Z, but there's that respected person in that community that understands the media, that knows how to get something in the New York Times. And so really connecting with community members that know how to do that is important. I don't know if that answered your question, but I think the media's role is supposed to be to give good information, but I don't necessarily see that happening. I see that what we seem to focus on are what's brought to their attention. Mm-hmm. Right, absolutely. Absolutely, but one of the other things, even in terms of the question that was asked about homelessness, how low did I feel to think that I was a 90-plus student and I got a 6-something? You know, that does something to your psyche. I still remember it to this day. Like, you feel like totally hopeless. And so not only possibly are your parents immigrants and they might not be able to give you that much direction. No offense, Mom. You did a good job. But, you know, you're looking for some direction. And so really, I think institutions like this embracing, or local churches really having these programs so that if students experience, they won't even have to experience that. So the dream of whatever they'd like to become doesn't get shattered. Because that's almost shattering for some people, you know? It makes you want to do something else, and you possibly could have been a brain surgeon. You just didn't know how to take the test. Okay. Yes. Mm-hmm.
Hi. So you mentioned that it's important to have local community organizations and community intervention plans to better improve the health of the community. But sometimes, say insider, outsider trust issues. How do the organizations get past that?
Absolutely. Insider, outsider trust issues. And I think that's a great example of trust building, in the sense that you really have to start from history and really understanding the history behind who's standing in front of you and why they feel the way that they are. But oftentimes, I think with community organizations, you come with your agenda. Oh yeah, okay, so we're doing this, and we're going to do this, and we're going to write this, and you have your own agenda, not really listening to the elders and where they're coming from. But I think that's why I say public health is very different from medicine, no offense, but you're really starting at the history. And when, it's not a small thing to be able to say, sure, I know how to say that. When I say that to someone and they're like, how did you know that? I won't tell them how I know that. But, breaking that barrier with something like language, with something like someone's historical upbringing, knowing, the trials of different people's history, I think that's the critical thing. So I think that ultimate thing with building trust is respecting someone's historical walk.
Just a thank you in Chinese.
Oh, yeah, sorry. Any other questions? I don't want to keep you from your food. Okay, thank you for having me.